We move to the next section, which is the nominations for Best Paper in the fields of medicine, pharmacy, and veterinary sciences. There was a pool of, we received a total of 34 papers this year, which was an increase of about 30%. And the nominated papers are ex vivo immunomodulatory effects of all trans-retinoic acid during Basset's disease, a study in Algerian patients, and received the paper from University in Algiers. So congratulations to them. The second paper was received from University in Wahran, and the title was A Simple and Accessible Screening Method for Congenital Thrombopathies Using an Impedance Hematology Counter. So congratulations to the group. The third was titled Evaluation of Healing Activity of PVA Ketosan Hydrogels on Deep Second Degree Bomb, Pharmacological and Toxicological Tests from Algiers. So congratulations to them. And last but not least, a combined effort from two universities from Tlemcen and Wahran on a paper titled Association Analysis of IL-10 TNF-alpha, IL-23L, IL-1, RB2 SMPs, wow, with Basset's disease risk in Western Algeria. So many congratulations to them. And the winner of this year's award is a paper titled Oral Delivery of Insulin from Alginate Ketosan Cross-Linked by Glutaraldehyde, written by the group led by Jamal Tahtat. So many congratulations to the group. So do we have Jamal? Okay, so we're trying to see. Probably we can offer comments in the meantime. Oh. Okay. Okay. Allô? السلام عليكم سي جمال. مرحبا بك، معك عبد الرزاق عضو في الفريق تاع النصر.org. اولا الف مبروك على الفوز تاعكم، على الانجاز المتميز في البحث العلمي نتا والفريق تاعك. الله يسلمك. ماذا بك تخبرنا وش هي الانطباعات تاعك واي تعليق على هذا الفوز؟ نعم.
يعطيكم الصحة، بارك الله فيكم. راني فرحان بزاف. إذا هو واحد يفرح يفرحوا السونتيفيك ديالو يكونوا هكذا في المقدمة، يقولوا هكذا في الصنايع يعني.
ما شاء الله. الله يبارك. يعطيك الصحة سي جمال.
على الجهد تاعكم وعلى انكم اخترتوا العمل العلمي تاعي كأول عمل يعني في المجال تاعي يعني. بارك الله فيك.
ان شاء الله. الله يبارك فيك، يعطيك الصحة. ان شاء الله راح نقدم لك دكتور علي بوستة، راح تعطيك تعليق على البحث العلمي تاعك.
اوكي، شكرا دكتور تحتات، والف مبروك مرة ثانية على الجائزة. I'm going to just give you kind of a brief introduction to everybody else in here about the work. So again, the overview of the paper of the year. So it talks about insulin. It was really good relation to our first speaker today. So insulin, as we discussed and discovered today, is actually a peptide hormone. It regulates carbohydrate and fat metabolism in our body. It's basically mainly in type 1 diabetes, where patients actually have a destruction of the beta cells in pancreas that we actually give insulin to patients. And basically the main way of giving insulin is via an injectable dosage form. So as you can see here, the patient here is actually injecting themselves with insulin. However, one of the main problems with injectable dosage form in general and in insulin in particular is that there is a low patient compliance. The patient don't want to inject themselves either because of fear or because of discomfort on injection. So one might think of why can't we actually deliver insulin orally? We can't actually do that because it's a peptide, as we said. It actually gets degraded by a proteolytic enzyme and also the acidic environment in the stomach. It also have a low penetration, so it can't really go across the lining of the intestine where the absorption of the drugs usually occur. So what our colleagues in Algeria, led by Dr. Tahtat, all basically have tried to do is actually make a new formulation or a new dosage form. So they try to encapsulate this fully absorbable insulin into kind of some beads or particles. So what they use natural polymers, which are actually used pharmaceutically, proven pharmaceutically. They are biodegradable, they are non-toxic, and also biocompatible. And those two main ones was allogenate, which is an anionic or a negatively charged polymer, and chitosan, which is a cationic polymer. So they've used the allogenate because it have a pH sensitivity. So what happens is it's stable at the acidic pH of the stomach, where we don't want our insulin to be degraded. However, it dissolves in the intestinal alkaline pH, which is a great for what we want or what they wanted, basically. Also, chitosan is a cationic, and it has also been used quite a lot in drug delivery and in gene therapy, for instance, because of its cationic properties, but also because they have mucoadhesive properties. So because the cell membranes are negatively charged, having something cationic will prolong the interaction with the epithelial membrane, especially in the intestine. And they've used also glyceraldehyde as another organic compound in there to improve the mechanical properties. So looking at the paper overall, what they made those beautiful beads, as they call them. They look like a tablet that you can take. And looking at the way they've done, and they looked into the research, they had a very beautiful full characterization of the beads. I was really impressed and amazed with the techniques that they actually have in Algeria, some of which sometimes it's hard to get hold in the UK universities even. So you got a TIR, SACAT scanning electron microscopy as well, and others which I'm not showing. Later on, once they prepared their beads, they actually asked the question, do those beads actually swell in simulated gastric fluid and simulated intestinal fluid? They tried to mimic what happens in the stomach and the intestine, and so they used a stimulated fluid. And they asked the question, do they actually swell? And that's an important question, because you have your insulin inside, but does it actually get out? And to get out, you need those kind of cross-linked polymer to actually swallow and open up. And they actually did find out that one of their formulation actually swallows very well, and more interestingly, that it actually happens in the intestinal fluid, in the place that we actually want our insulin to be delivered. We don't want it to be swallowed and to get released here. However, this question didn't actually answer the question, is insulin actually getting out of those beads? So they actually asked that question and tried to answer it. So can insulin be released from the beads? So Dr. Tahtat, all looked at the cumulative release of insulin, again in the simulated gastric fluid and simulated intestinal fluid, and they found out that it does actually go out, it is actually released, and they showed that when they quantitatively calculated that, it was around 300 international insulin unit, which is quite kind of in a good range of what you need to have. The last kind of question, which was also important, which relates to having chitosan as a cationic polymer there, is, do the particles adhere to the biological tissue? Remember that we said insulin actually have a poor penetration to the intestinal fluid. So they actually asked that question, and they found out that about 90 to 95% of those beads adhere to the mucosal surface of the rat intestine in vitro. So it was a very, as I would conclude here, it was a very systematic work, very well written and structured paper. And again, and one of the biggest things with it is actually its therapeutic potential. So once again, congratulations to Tahtat et al. In Algeria.